Today, I want to talk about what we can do to prevent horrible, horrible health conditions in old age. Now, I am not a doctor. Hello, by the way, my name is Megan. I am on a GLP-1 journey, if you will. I am on Tirzepatide. I've been on it for about 5 weeks, and I am on a mission to get healthier, to be more active, to be less susceptible to some of these things that I want to talk about. Now, who am I? Why should you listen to me? Or what experience do I have? Well, I am not a doctor. I'm not a nurse, so this is not medical advice. However, I am a licensed clinical professional counselor in the state of Illinois, and I have worked in elder care and healthcare for a lot of the last 14, 15 years that I've had a license to practice. So that looks like I've been a discharge planner in hospitals. I've been a discharge planner and social services director in nursing homes and long-term care communities. And I have been a memory care director with people with dementia. And currently I have a private counseling practice where 3 days a week, I work with people in my office, a lot of whom have had strokes, traumatic brain injuries, early stages of dementia, or they are the caregivers of people in that position. And I also work 2 days a week in a nursing home where my whole job is to go in and sit with people and talk with people and help them process all of the things that are going on for them as they have lost their independence, lost their good health, lost their physical abilities. So I think I am in a unique position to talk about what happens to people as we get older if we don't take good care of our bodies. So let's get into it. I have a list here of 10 diseases / conditions that I have seen over the course of my career. I've seen more than this, right? But these are the ones that really I see a lot of and that really scare me personally. So I'm going to just talk about them pretty quickly, give like an overview, and then I'm going to talk about what I think we can realistically do to minimize our own risk for these things, as well as if they do happen to us, what we can do to make the experience less horrible. Okay? Because these things I'm about to talk about are not fun for a lot of people. So I'll just do the list and then we'll get into some commonalities, maybe like some details. So here are the things. 1 is type 2 diabetes. 2 is limb amputations. 3 is stroke. 4, heart attack. 5, COPD/emphysema. 6, depression and anxiety. Stay tuned for more on that. 7 is just loss of mobility or becoming wheelchair or bedbound without like an actual injury occurring, but you just lose it because you didn't use it. 8 is dementia/Alzheimer's/ Parkinson's, Lewy body disease, all of that realm. 9 is cancer. I know we're going to get into this. I know cancer cannot always be prevented. I understand, but we're going to talk about that. And then caregiver burnout. We're going to talk about caregiver burnout. So as we get into all of these things, I do want to make it abundantly clear. I am not victim blaming or shaming anybody, okay? I fully understand that most of these things come with a genetic predisposition component, okay? I understand that most of these things also come from things like socioeconomic status. That can have a big impact, right? If you grew up in poverty or if you're still living in poverty, it's going to be harder to avoid some of these things. I also understand just, again, if the home environment you grew up in, if you have had trauma, if whatever, right? There's a lot that can go into these things. So if you already have diabetes, or if you've had a stroke, or if you are developing dementia or whatever, or Parkinson's, right? I'm not sitting here telling you, or especially depression and anxiety, I'm not sitting here telling you that it is your fault that you didn't make better choices. That is not the message. I just want to be clear. However, I do believe, after all that I have seen, after meeting thousands of people over my career who are experiencing these things, I do believe that we can certainly reduce our risk for some of these by taking certain actions. And I also believe that if these things do happen to us, there are still things we can do to make the suckitude less. Okay. So let's get into all of that. So I will start with the things that I personally am at higher risk for, or that I am scared of, okay, or that I'm experiencing now, right? So anxiety and depression. For somebody my age, I'm 42 years old. I am so tired of hearing like, oh, you're depressed. Well, why don't you just go get outside, go take a walk, okay? Get out of bed, go do something, take a shower, right? I do understand that for some people, depression, anxiety, other mental health disorders are fundamentally just the way that your brain is, okay? There's a chemical component to it, a genetic, physiological situation. There's not a lot you can do, okay, except take medication, right? But here's why I have it on this list, especially in regards to older people. When we don't take care of our bodies, when we don't move our bodies, when we don't eat whole foods and, fruits, vegetables, lean proteins, healthy fats, when we don't eat properly and exercise enough, then we tend to isolate. We tend to not feel so good. We tend to not be as resilient as we could be. And also the depression and anxiety can be a result of having some of these other chronic conditions or these debilitating conditions where, something like COPD or emphysema, if you can't breathe and you can't catch your breath and your lungs can't fully fill with oxygen, you're going to feel anxious, right? So I think all of these things sort of go together. So for me, one of the most important reasons why I started a GLP-1 medication, why I personally went on Tirzepatide, is because I see all of these things. I see people with type 2 diabetes who are, they have poor circulation in their legs, and then they end up getting a wound, and then they end up getting an infection, and then the infection ends up getting worse, and then it spreads to their bone, and then all of a sudden doctors are telling them they have to have their lower leg cut off, right? They have to have an amputation because their body isn't working well enough to fight off the infection because there's not enough circulation. And if the infection doesn't get cut off, literally, it could spread to the rest of the body, to the vital organs, and then you could die. I have seen this happen multiple times where people end up with a small infection and they just can't get it under control. And then boom, they don't have a leg. So I'm not saying that to scare anybody, especially if you already have diabetes. But what I am saying that for is because I've seen it over and over and over again with multiple people I've worked with. And it's a real bummer. Like, it's not something that you want, okay? It's not an experience you want to go through if you can avoid it. So for me, I am at a high risk for developing type 2 diabetes. My mom has it. My dad's dad had it. And I am on pace to get it myself in older age if I don't get my life in order right now. I may still get it. I don't know. I can't guarantee anything. This video isn't about guaranteeing that you never get any of these issues. But if there are things that I can do to sort of reduce my risk or make myself as resilient as possible if it does happen, why not, right? So what am I doing? Taking a GLP-1 medication. I am exercising every day. I am trying to make sure that not only am I walking every day, but that I have good mobility. I can get up and down from the floor. I can stretch. I can reach. All of these things are very important as you get older. Now, how does the GLP-1 fit into this? A lot of you probably already know, especially if you're taking it, but GLP-1 medications such as Ozempic, Wegovy, Mounjaro, Zepbound, and then the compounded versions of all of those, they allow you, for me anyway, I'll talk about myself because I'm not an expert, not a doctor, don't take this as medical advice, but the medication allows me to make the choices that I already know are correct for me or healthier for me, better for me, without being on Tirzepatide. I'm a smart cookie. I knew that eating cake or eating donuts or eating McDonald's on a regular basis was not good for me. I knew that piling my plate up with as much food as I possibly could, if it was tasty to me, was not a great idea. But my actions were not following. Do you know what I mean? Like, I don't know if this is relatable to you, but it was like a compulsion. Like, I couldn't stop myself. No matter how much I knew it was not the right choice, I kept doing it, right? Same reason that I have trouble with building up a savings account or not going into credit card debt, right? It's like, you know the correct thing, but the impulsivity, there's a harder time putting time and space and a pause between you and the action, right? Between me and the donut. So that's why Tirzepatide is helpful and important to me, because it is allowing me that moment between I want a donut and actually driving myself to the bakery to pick up a donut. You know what I mean? So that is that. That's my spiel on diabetes and whatever. Now, some of these other things, cancer, same thing. Obviously, there are many types of cancer that there's nothing you can do, right? Either you have the gene or you don't have the gene. Either you have bad luck or you don't have bad luck. You know, I used to follow a lady on YouTube named Jenny Apple, or her real name's Jenny Appleford, but the channel was called Jenny Apple. And she was a vegan. She did yoga every day. She went for walks with her kids every day. She ran. She was a very, very healthy woman by all accounts. She was very health conscious about the products that she used on her skin and in her home. She did everything right in order to avoid things like cancer. However, at 32 years old, she got diagnosed with lung cancer. She'd never smoked a day in her life, never used bad products. She just had crummy genetics, right? She just had bad luck. In cases like that, there's not a lot you can do. There's just nothing you can do, right? But for other things, other types of cancer, if you can avoid overdoing it with the sugar, if you can avoid living a sedentary life, if you can make sure that you're strong, make sure that you're taking care of your mental health, you're not becoming morbidly obese, right? Or not staying morbidly obese if you already are, maybe you have a better shot. Maybe you have a better shot at not developing those certain types of cancers. I don't know. Something's going to get everybody, right? Eventually, all of us are going to die from something, unfortunately, right? That's just the way it is. But what we're talking about here, again, reducing the risk. Now let's get into the heart and cardiovascular stuff, like your strokes, heart attacks, heart disease, that kind of thing. Again, I have high blood pressure currently. I have had high blood pressure for several years. I also had, right after I gave birth 3.5 years ago, I had severe postpartum preeclampsia, which is not well understood by medical professionals, unfortunately. But essentially, I had ridiculously high blood pressure and I had liver issues, liver enzyme issues. And so I was very, very sick. My blood pressure was, again, out of control. I was on an absurd amount of blood pressure medication for a few months after I gave birth, just to keep it in like the 130s, 140s over 80s and 90s. Like, it was severe. And then since then, I've just had regular old run-of-the-mill hypertension. And that is a concern for me. That I am tired of that. I don't want to keep living like that because I work primarily with people who've had strokes. And that is not a fun time. I don't know if you've ever had a stroke. I don't know if you've ever met somebody who's had a stroke, or if you've ever spent significant time caring for someone who's had a stroke. It is a terrible, no good, very bad experience for almost everybody who has a stroke. Can we prevent all strokes? No, of course not. We cannot all prevent strokes, okay? There are some people, I've had a couple of clients myself, who they were very healthy people. They never had high blood pressure before. They never had, any medical issues really before. They exercise regularly. They were eating a pretty good diet. They just happened to have a stroke, right? In those cases, again, there's nothing you can really do. However, many, if not most of the people that I have come across throughout the years in my work, let's just say they were not shocked when they had a stroke, right? They were not like, oh my gosh, how did this happen to me? Like, they all kind of knew they were living on the edge prior to the stroke. So what are the things that sort of lead up to something like that? Well, number one, excessive alcohol use or abuse. I mean, quite honestly, right? So people who, for their whole lives, have been big drinkers, eventually it will catch up with you in one way or another, right? Whether it's through your liver or through your kidneys or through diabetes, things like that, or through your cardiovascular health. Either way, not great, but excessive alcohol use, no bueno. Again, I'm not blaming anybody, but one common thread I've seen with a lot of people who have had strokes is that they did drink a lot before they had the stroke. So for long periods of time, like years and years and years, decades. That's one. Smoking, obviously, is another high risk factor for stroke. If you're smoking, stop. I'm not even going to beat around the bush. Like, just, there is no reason to be smoking anymore in the year of our Lord, 2026. Like, we all know what the risks are. We all know that you can get cancer, you can get strokes, you can get heart disease, you can have all kinds of problems. Please stop smoking. Please. There is a great book that I used to stop smoking called Alan Carr's The Easy Way to Stop Smoking. I listened to it on Audible and it was amazing. I highly recommend it. I will have a link to that book in the description box. I am an Amazon associate for right now, so I will earn a commission if you do buy it through that link, but look it up on the internet, buy it as cheap as you can, wherever you can find it. Alan Carr's The Easy Way to Quit Smoking. If you smoke or vape, please stop. Okay, that is my PSA. And then the last thing you can do to prevent a stroke, or the last two things, is exercise regularly, right? I know for me, if I skip my daily walk too many days in a row, like even 2 days in a row, I feel it. I feel it in my body. I can feel the blood pressure rising if I skip my walk too many days. I try to take at least a half an hour brisk walk every single morning. And I do believe that that helps me a lot. If you could do more, that's amazing. But that is like my bare minimum baseline that I have to do. Otherwise, I don't feel well. Another thing that you can do, of course, is try to eat better. Try to eat better. If you struggle with that, talk to your doctor about GLP-1s or whatever they might recommend. Maybe everybody doesn't need a GLP-1. Maybe like some people I know have started taking metformin and that works for them. But whatever it is that will help you with your eating, with your blood sugar, with making good choices for yourself, I highly recommend that you figure something out, because I wasn't able to do it on my own, but now I have help. So that is stroke and heart attack. I have 2 more things I need to talk about in more depth, and then we will conclude, because I'm sure this is getting kind of long. But I am very passionate about this because, again, I see it. I see it every day, and I see a lot of people stuck in a nursing home who shouldn't have to be in the nursing home, you know? So here we go. Dementia. Dementia can come in a lot of different forms. Dementia can mean Alzheimer's. It can mean, some people with Parkinson's have dementia. Some people have Lewy body dementia. Like, there's a bunch of different ways that you can get dementia, which is basically just sort of a catch-all term for memory loss and cognitive function issues, right? So maybe you're having trouble with your speech. Maybe you're having word finding difficulty. Maybe you can't remember where you put your keys. Maybe you can't remember who your spouse is anymore, right? Dementia is sort of like a broad term. Again, as with many of the things we're talking about, not everybody can prevent dementia, right? Not everybody can prevent memory loss, cognitive loss, all of that, okay? Like, there are genetic components, there's environmental components. It is what it is. But what I will say is there are some things we can do to decrease our chances of getting severe dementia and to maybe push it out as long as possible. Like, let's say you already have a predisposition for it, but maybe, because like your mom had it or your dad had it, your grandpa had it, whatever. But maybe you can sort of like kick the can down the road as far as possible so that you're not like 70 with dementia, right? So here's what I would say. Number 1, you need to see a doctor regularly, not like once every couple years, not only when you have like, your limb falling off or you have an injury. Like, you need to have a regular relationship with a doctor that you trust. Now, why is that? I'll tell you. Because there are so many things that can happen slowly, that can happen over time, that if you don't catch it at the beginning, it's going to get worse and worse and worse. And then by the time it's a problem, it's a problem. So that would include things like hearing, getting your hearing checked regularly. It is well known that if you have hearing loss as an older person, like if you start losing hearing, if you already have been deaf your whole life, or hard of hearing your whole life, I don't know what the statistics are on that. I actually really have no idea. But with people who have hearing loss, like they've been hearing their whole life and then they start losing their hearing, if they don't address that, it can lead to cognitive issues, right? Because your brain will start to fill in things that you can't hear. Your brain will start filling in weird assumptions and things can go a little haywire. Like, you will miss out on a lot of reality and then your brain starts doing weird stuff. So that is one thing. If you notice hearing loss, if your family members are telling you that you're starting to lose your hearing, please believe them. Please listen to them. And please go to an audiologist and get something to help you hear. I know Medicare, at least as of right now, I don't think Medicare covers hearing aids, which is a real shame because they're very expensive, or they can be. But I do know, like my mom has shared with me, that places like Costco, if you have a Costco membership, they have an audiologist there and you can have some affordable options available. So hearing loss is a big thing to take care of. Another thing to take care of would be your diet, your exercise, and your socialization. So again, we've talked about diet and exercise a million times. I don't think I need to belabor the point. But another thing that you might not think about is socialization. So the more you can be around other people, kind of like what I was saying with the hearing loss, like if you're just kind of living in your own little world and you start getting squirrely, you might not realize what's happening. And so it is important to be around other people. It is important to listen to your family members. It is important to do your best to stay mentally stimulated. Okay. Now, if you already have some cognitive loss, because I work with some people in my counseling practice who already have been diagnosed with dementia, but they haven't they haven't lost their ability to have conversations. They haven't lost their ability to drive. They haven't lost their ability to hang on to things, but they do have some issues. Okay. Like they caught it really early. So things you can do: get a referral to speech therapy. I know that sounds weird, but speech therapists can also help with cognition. They can give you exercises that you can do. They can give you speech exercises you can do. They can give you brain exercises that can help you maintain and maybe even improve a little, but to at least maintain where you're at, right? So that you're not like taking a nosedive in your cognition. And then the other thing you can do is work with an occupational therapist who may be able to help you find some workarounds for things that are causing you trouble. So for instance, I know a gentleman who, as scary as this is, like he still drives, and he sometimes while he's driving may forget where he's going or what he was doing. But he does still know enough to know that he can stop and pull over, right, in a safe area, in a parking lot, whatever, and he can use his iPhone. He's been great with technology his whole life. He's kept up with it. So he knows that he can use his workaround on his phone. He can use his GPS to reorient himself and to remember what he was doing.
I love you, Mama.
I love you. So there are things you can do if you've already started to have some decline cognitively. There are things you can do. There are workarounds. There are hacks. But if we can do what we can to push that off as long as possible, obviously that would be ideal. So eating things that are high in healthy fats like salmon and even taking a fish oil supplement, things like that. Again, not a doctor, not medical advice, but if you are concerned about cognitive decline, I highly, highly recommend that you talk to your doctor. And last two things I'll say about this, because I'm passionate about it, is number one, don't be afraid of cognitive testing. Do not be afraid of cognitive testing. You want to do the cognitive testing so that you have a baseline. So do it early. Do it do it now. I don't care how old you are. Like do one now so you have a baseline. Like I should probably take one now so I have a baseline so that in the next few decades or next few years or wherever you're at, if people start to say, hey, are you okay? And then you go get tested again, they'll be able to see where you were and now if you're about the same, if you've gone down, if you've gone up, whatever. So that's one. And then the last thing I'll say about dementia cognition is, this isn't like a prevention tip, but this is just a practical life tip. Get all of your paperwork in order now. If you don't have a power of attorney for healthcare, you need a power of attorney for healthcare written and signed and witnessed, okay, by somebody who's not a family member. You need to have that document, and you can have it, but you also need to give copies to the person that you want to be your decision maker if you can't make decisions for yourself. So like if that's a son, a daughter, a spouse, a cousin, a friend, whatever, you want them to have a copy so that if you're in the hospital or if somebody needs to know who's legally allowed to make decisions for you, they can show up and say, yep, it's me. Oh, and also you should give it to your healthcare provider so they can put it in your medical record so that if you end up in the hospital, it's already in your medical record and nobody has to even ask questions, right? So that's number one. Number two, make sure you talk to that person. So if you pick somebody that you want to make healthcare decisions for you, you need to talk to them, right? They should know first that you've chosen them so that they understand their responsibility and they understand what your wishes are, right? Everybody has different wishes for their care if they're not able to make decisions. So talk to the person, pick a person, have it in writing, have it signed, and make sure everybody's got copies who needs a copy. The other thing you need to do is financially, if you need a power of attorney for finances, you can Google. There's a lot of like online legal companies that do it for free or for a small fee. Or I think almost every state in the United States has a free online version of power of attorney for finances. And you need to get that filled out, assign somebody that you trust to be your proxy who can manage your affairs financially, like your bills and your bank accounts and your house and whatever, if something happens to you and you can't make those decisions. That one, I do believe in most states needs to be notarized. I do believe. So that one's a little more complicated. But again, not legal advice. Just look it up in your state, what the rules are, and find that out. Because the worst thing that can, well, not the worst thing, but a bad thing that can happen is if you do lose the ability, either temporarily or permanently, to make decisions for yourself, you need somebody to be able to pay your bills. You need somebody to be able to pay for your care. You need somebody to be able to sell your house if you need access to those funds. Do you know what I mean? So if you don't have that document, then nobody's going to be able to help you out or access your accounts. So that's a really important thing. So sorry, that was kind of a tangent, but also like I just feel like it's a big responsibility for me to tell you because a lot of people don't want to think about that, especially if you're younger, especially if you're in like your 40s, 50s, 60s. People don't want to think about that. But it could happen. Anything could happen. Anything could happen. I don't have one. I should have one. And I'm 42. So that's my spiel. And then the very last thing I really, really need to talk about before I go play with my kid, because she's being super patient right now. We're home. We're having a little bit of a sick day, right? Yeah, we're having a little bit of a sick day. She's fine, but she has a cough. Thank you. That's she's a paid actor. The last thing I want to talk about is caregiver burnout. Now, what does caregiver burnout have to do with a GLP-1 medication? I will tell you, I cannot say enough how many people, mostly women, going to be honest, mostly women, but not all women. There are some men who are good caregivers. There are some, okay, but mostly women. I'm talking to the women. There are so many who I have met, who I work with, who I have come across throughout the years, who completely abandon themselves, completely abandon their own health when their spouse or their parent or even their child has a severe issue, right? Like a health issue, a mobility issue, a developmental issue, a cognitive issue, right? Like when you dedicate your life to taking care of someone else, it is very easy to abandon yourself. It is very easy to put off the workout. It is very easy to put off the cooking. I myself am guilty of this, right? The last thing I ever want to do is cook lately. I don't like it, right? It's not fun. It's not easy. It's not something that I want to spend my time on. And so a lot of times what people end up doing is just relying on fast food or delivery or pre-prepared meals that have like way too much sodium or way too much sugar or way too much whatever, right? So what I'm saying here to you is if you are caring for other people or another person, it is extremely important that you find support, whether that is, whether that's through like a church or a community organization that you're part of. and maybe you have a connection with some other people and maybe you kind of swap watching out for the others, or whether it is paying for help, right? There's no shame in that game if you can afford it. Or if it's just asking your friends and other family members. But what you can't do, what you shouldn't do, is rely 100% on yourself all of the time to do everything. Because when you do that, and I understand financially and socially, like there are issues, right? I get it. I understand that not everybody has a big community that they can rely on. I understand that not everybody has a lot of money. I get it. But you need to do whatever you can in your power to find other people that you can work with or that you can rely on and trust to help you. Because if you never get a break, if you never take a moment for yourself, if you never get on that treadmill or go around the block for a walk, if you never go to your doctor yourself because you're always going to appointments for everybody else, I can tell you what happens. I have met so many widows who now, they spent years taking care of their husband at the end of his life, making sure he got to every appointment, making sure he had the best care, making sure he had the best food, making sure he had whatever he needed to make him comfortable for the last years of his life. And then when it's her turn, right, when she's sick, when she's injured, when she's whatever, she's alone in a nursing home. Okay? Like, you need to build community, whether that's with your adult children, whether that's with friends, whether that's with your own siblings or cousins or whoever you've got. If you're not religious, join a church, right? Like, do whatever you need to do to gather people together and become a group and care for each other, look out for each other, support each other. Doing stuff alone is never, ever going to go well. It's never going to go well. I am an introvert through and through, but I will tell you one thing I have learned from working with older people is that being alone is not good. It is not good. So I know it may feel really hard, especially if you already are older, especially if you are isolated yourself. I hear you. I understand. I know groups are not for everybody. I know it can feel intimidating, but I will tell you that if you get to the end of your life and you are totally alone, it is a very vulnerable, scary place to be. So, in conclusion, I've said a lot. This has been a long video, longer than usual. This will not be typical content here, but this is something that I really wanted to share with you guys because, like I said, I've worked in healthcare for a long time. I've seen a lot of really sad things. I've seen a lot of really scary things. And I do believe that staying in touch with your healthcare provider on a regular basis, going to your annual checkups, going for lab work, all of that is super important. Doing whatever you need to do to be able to exercise, right? Even if it's only a few minutes a day, you got to keep that up. Doing whatever you can to be able to eat well and eat whole foods, eat unprocessed foods as much as possible. These are all things that we can do. Some of them may be harder, right? Especially the socialization piece, especially the gathering people around you and having support. That can be really tricky for a lot of people. But these are all things that right now, as a professional counselor, as somebody who works with sick people, with old people, at 42 years old, these are the things that I am looking at now as my top priorities and why I am on a GLP-1 medication right now, because some of these things, like eating well, are things that I was not able to do on my own without help. So let me know in the comments below what stood out to you about this talk. if you are going to make any different choices moving forward, if there are any action items from what we've talked about today that you are thinking about trying, and let me know if there's anything I left out. I could talk about this topic for years and probably never be done, right? I could have gone in depth on any one of these things probably for like an hour, but nobody wants to hear that. Or I don't know, maybe you do. Let me know if there's anything that you do want to hear more about or that you are more curious about. But I just wanted to kind of give an overview and hopefully help some people, hopefully give some people some hope and also some action steps that you can take that will help you as you approach your older years. So thank you for watching, and I will hopefully see you in the next video. Bye, guys. All right, thank you so much. Now I can play with you. You were so good.